Hello, I'm Dr. Nadine Gracia, Deputy Assistant Secretary for Minority Health and Director of the Office of Minority Health at the U.S. Department of Health and Human Services. Every April, during National Minority Health Month, we honor the tireless efforts of health professionals, community leaders, advocates, and all those who work every day to improve the health of minority communities. In many ways, health serves as one of the most literal yardsticks of opportunity in our country. Health is where so many other issues, social, economic, environmental, converge. Health is where the urgency of progress isn't just seen or heard, but felt. That's why the persistence of racial and ethnic health disparities is so alarming. Today, nearly 50 years after Dr. Martin Luther King Jr. spoke out about the injustice of inequality in healthcare, minorities continue to live sicker and die younger than the rest of the population. Minorities are also more likely to be uninsured, are less likely to get the preventive care they need to stay healthy, less likely to receive quality care when they get sick, and more likely to face poorer health outcomes. These health inequities not only burden communities of color, but also exact a tremendous cost on our country, whether measured in economic terms or considered in the context of how our nation is living up to its promise of equality. But this year, as we commemorate Minority Health Month, we do so knowing that we have an unprecedented opportunity to make remarkable progress toward health equity. The Affordable Care Act, the healthcare law signed by the President 3 years ago, is one of the most powerful pieces of legislation in our nation's history that will help reduce health disparities. With its emphasis on expanding coverage, making healthcare more affordable, and providing better access to quality care, the Affordable Care Act is transforming healthcare for Americans all across the country, especially those in our most vulnerable and underserved communities. And it is already making a difference in the lives of millions of Americans. More than 3 million young adults have gained coverage because the law allows young adults to stay on their parents' insurance until the age of 26. Millions of Americans, including minorities, who have higher rates of many chronic conditions like diabetes, heart disease, and cancer, now have access to important preventive services for free, such as diabetes screenings, mammograms, and immunizations. The Affordable Care Act also invests in training and placing thousands of new doctors and nurses in communities that need them most. And it's also increasing the number of community health centers across the country, providing care in underserved communities. And this is just the beginning. Starting this October, millions of uninsured Americans will be able to find health insurance that meets their needs at the new health insurance marketplaces. The marketplaces will give Americans who are uninsured or who buy their own coverage a whole new way to shop for insurance. As implementation of the Affordable Care Act continues, our charge is to press ahead, to keep the momentum going, to ensure that we make the most of this remarkable opportunity. And whether we rise to meet it, whether we can look back 50 years from now and consider this period of history as the moment when we faced an unprecedented opportunity for change and made the most of it, depends on all of us working together. This year's theme for Minority Health Month, Advance Health Equity Now, uniting our communities to bring healthcare coverage to all, is a call to action for everyone to come together to solve one of our nation's most pressing and persistent challenges. I invite you to join us, and I look forward to working with you in the weeks and months to come as we work to educate communities all across the country about the benefits of the healthcare law and ensure that Americans in all communities have the chance to reach their full potential for health. To learn more about the Affordable Care Act and the benefits that are coming, please visit www.healthcare.gov. And to learn more about Minority Health Month, please visit the Office of Minority Health website at www.minorityhealth.hhs.gov. Thank you.